So it is used for nasogastric drainage. Then what else you should say after that? Which scenario it is used? Intestinal obstruction it can be used. It can be used in perforation peritonitis also. Anything else? Other uses? Before surgery, okay. If the patient is not NPO and you want to make the stomach empty, then this can be inserted. Anything else? Yes, very good. It can be used to give gastric lavage and poisoning. Yeah. Okay. Then, so broadly we can divide the uses of Ryle's tube into diagnostic, therapeutic, and other uses. Okay. In the diagnostic, what we can do is you can diagnose gastric outlet obstruction. Okay. How will you know the gastric outlet obstruction is that? Through clinical features. And when you put the Ryle's tube, the amount, the content if the patient has not taken food recently, and you insert the Ryle's tube and you find the content, the amount of effluent to be more than 200 ml. Okay, then you can diagnose gastric outlet obstruction. Fine. Anything else? Okay, yeah, we won't be able to insert a Ryle's tube in case of tracheoesophageal fistula. Okay. Yes, in case of okay, I'm not sure regarding that use. Anything else? Any other diagnostic use? It can be used for diagnosing upper GI bleed. Okay, so patient is saying that he has hematemesis. Okay, now you are not sure. You are thinking that is he coughing and then again swallowing it up. Okay, so you can put a Ryle's tube, and if that in the Ryle's tube the drainage shows fresh blood, then you can diagnose that there is upper GI bleed. Okay. Another test is a diagnostic test, that is Hollander's test. Okay, so what is done in that? This is done to assess the completeness of vagotomy. Okay, might have read in peptic ulcer disease, Hollander's test. So what is insulin is given at the rate of 0.1 unit per kg. So this insulin will produce hypoglycemia, and this hypoglycemia will stimulate gastric secretion through the vagus nerve. So when vagotomy has been done, this gastric secretion won't happen in that manner what is expected. Okay, so this test can be used for doing to assess the completeness of vagotomy. That is called Hollander's test. Okay, so there are three diagnostic tests that can be done. One is to diagnose gastric outlet obstruction, to diagnose upper GI bleed, and to assess for the completeness of vagotomy, that is Hollander's test. Fine. Okay. Then therapeutic. Therapeutic, we have said to decompress the stomach in case of acute intestinal obstruction, to also decompress the stomach and the small bowel in case of perforation peritonitis. Therapeutic, you can give lavage to the stomach, and in case of poisoning, and it can also be used following any major surgery. Okay, suppose you have done a gastrojejunostomy and there is an anastomosis very immediately after the stomach. So in that case, what we can do is that we can insert a Ryle's tube and decompress the stomach so that the anastomosis is given rest. Okay, so following any bowel resection anastomosis, this Ryle's tube can be used. Okay, other uses come as feeding. Where can you use Ryle's tube as a feeding tube? Yes. Any comatose patient. Okay, so for nutrition you have to insert a Ryle's tube. So in that case, you can give. Suppose now there is an obstruction in the esophagus. Patient is not able to swallow. So if you can pass the Ryle's tube through that narrow channel into the stomach, then also patient can feeding can be given through that. So in a comatose patient, in a patient who has dysphagia, you don't know what is the cause of it. So before treating that cause, to improve the nutrition, you can give feeding through the Ryle's tube. And another cases, you can do a feeding jejunostomy also. Okay, so in these ways you can give feeding. Okay, so these are the uses of Ryle's tube. Now, how do you sterilize it? How will you sterilize it? Autoclaving. It's not a metal. Okay, it is a made up of polyvinyl chloride. So it should not be autoclaved. It should be either sterilized by gamma irradiation or ETO, ethylene oxide. Fine. Okay. So it is sterilized by gamma irradiation or ethylene oxide, ETO sterilization. So what other questions you might be asked? What is the length? What is the length? How do you insert it? What is the importance of this color? Okay, at the tip there is a color which is radio opaque. So this helps in knowing the position of the tip with respect to various parts of the stomach or the esophagus. To know the position where it is lying, this radio opaque tip is very helpful. So you can do an X-ray, find out what is the position of the tip. Okay, then the length of the Ryle's tube varies from 100 to 110 centimeters depending upon the company. Usually it is around 100 centimeters. Okay, now there are some openings over here. Okay, so these are all the openings which should lie in the stomach. Okay, so the tip should be somewhere in the pylorus, and the opening should be there in the body of the stomach. Okay, now there are some markings. Okay, here, yeah. So can you appreciate this one? There is a marking over here. Okay, and then when I go distally, there is 2 marks over here. Can you see 2 marks? Okay, and then there are 3 marks. Fine. So this 1 mark indicates that it is likely the tip is near the G junction. Okay. The second mark says it is probably in the body. Now it depends upon the length of the height of the patient. Okay. So you can't say exactly. So this 1 mark corresponds to 40 centimeters, which is roughly at the G junction. Second mark is 50 centimeters, which is in the body. And the third mark is around 60 centimeters, which is in the pylorus. Okay, fine. So Ryle's tube is over. Okay, so everyone clear with it? What are the questions you will be asked? Okay. What is this? Foley's catheter. Okay, so once you get this, what are you going to tell? It is a Foley's catheter used for bladder drainage. Okay, then which scenario you are going to drain the bladder? Which, any particular case? Acute urinary retention, very good. Or chronic urinary retention also you can. Okay, whenever there is an urinary retention, to relieve it, you can put a Foley's catheter. Anything else? Yes, monitoring of the urine output. When you want to monitor the urine output? Any post-operative patient who has underwent appendectomy, would you like to measure the urine output with the Foley's catheter? That he can void by himself. So any major surgery, making the patient prone to making the patient bedridden. In those cases where the patient is unable to ambulate, so in those cases, to monitor the post-operative urine output. Okay. Then in patients with any major surgery, even not bedridden, but you feel that suppose an abdominal surgery like pancreatic urinectomy or gastrectomy, where you want to monitor the urine output so that you know that this is the you are hydrating the patient in the post-op period adequately. Okay, so know that also we can put a Foley's catheter. And finally, to monitor the urine output in patients with renal failure. Okay, when a patient is in renal failure, you want to know the monitor the urine output to know that this is the urine output, so I'm going to give this patient this much amount of fluids. Urine output is only 100 ml, so you have to give maximum 100 plus 750, that is around 850 ml of fluid should be given. Okay. Yeah. So the parts of the Foley's catheter. It has got a, what is this one? It has got a tip. Okay. Close to the tip there is an opening which is called eye, and after that is the balloon. Okay. So the balloon can be inflated. So there are two outlets over here. Okay. And two outlets, I want to say two channels over here. One is the colored channel. Okay. Which has got a plastic valve over here. So this is a one-way channel. Unless if you put distilled water through here, it won't come back. But this one is another channel. This is a two-way channel. Something can go also, something can come out also. So this is used for collecting the bigger one, larger one is used for collecting the urine. The one which is colored is used to instill distilled water so that the bulb, okay, just distilled to the opening is inflated, and this prevents the bulb from coming into the urethra and makes the catheter self-retaining. Okay. Now, what amount of distilled water you want to instill in it? Okay. So that is always mentioned. It depends upon the catheter, which catheter it is. I'll just open and show you. So very small size catheters will require just 10 ml. When the catheter size increases, it may go to 20 ml, 30 ml also. Okay. Okay. Can you see? I think over there it must be coming inverted. So that is 15 ml. And you see something written as 14, the one which is there in the center, 14 FR. That is 14 French. That is the size of the catheter. Okay. So how is this French related to the diameter of the catheter? Yes. Whatever the size is there in the French divided by 3, that is the diameter. Okay. This French actually corresponds to the circumference, and when you divide it by pi, that is roughly 3.14. So we take it 3, that is the diameter of the catheter. Okay. That is the name of the catheter. Okay. This is what in the center, what you're going to say, SIS COTH. Okay. Over there, I think it is inverted. So this is the size 14 French. It is written 14 FR. And this is the amount of saline which you should or distilled water that you should instill into to inflate the balloon. Okay, and this is the side channel. Okay, here as you see there is a valve over here, the colored one, green color. It has got a valve. So after pushing distilled water through it, distilled water won't come out, and this makes the catheter self-retaining. Okay. So what are the other uses of this catheter? So one you said is retention of urine, monitoring of urine output, Anything else? So when Rayleigh tube is not there, this Foley's catheter can be also be used as a feeding tube in feeding jejunostomy. Okay, in feeding jejunostomy, this Foley's catheter can be used as a feeding tube. So whenever there is any bleeding, epistaxis, which is posterior nasal, so this Foley's catheter can be passed and inflated, thereby having a tamponade effect and control bleeding in epistaxis. Similarly, suppose you have inserted a port in laparoscopic surgery. You're doing a laparoscopic surgery, you have inserted a port. Now around you have injured, while passing the port or the trocar, you have injured a vessel which is bleeding. So to control that, what you can do, you can put a Foley's inside, inflate the balloon and then withdraw it. So this will create a pressure around that port side and thereby help in controlling the bleeding. So these are the other uses of Foley's catheter. Fine. And you must be using this Foley's catheter in some other place. Huh? Tourniquet test. Okay. So that is another use of Foley's catheter. Yes, anything else? Yeah, that can be used over there also. So that if you answer in gynae examination, that will be good. Okay, we'll move on to retractors today. Other instruments we will be discussing subsequently. So today we'll be covering the retractors and some tubes. So two of the tubes we have discussed. We'll move on to another tube. This one. Okay. Can you see some number over here? Yeah, one is 8, another is, it looks 2, but it is 5. Okay, it appears inverted over there. It is 5. Okay, so what it is? It is a Lister metallic urethral dilator or metallic urethral bougie. Okay, it is used to dilate the urethra. It is used to dilate the urethra whenever you feel that there is some narrowing, feel some stenosis is there, not a long segment, short segment. Okay, say suppose BPH is there, or patient has underwent catheterization. Following catheterization, there is some stricture. So in those cases, to relieve that, before putting a Foley's catheter, this can be used. Also, like following your cystoscopy, to dilate the urethra, this can be used. Okay. Now there is a tip which is olive shaped, and there is a base which has rounded, and it has got numbers. The smallest number represents the diameter at the tip, and the largest number represents the diameter close to the base over here. Okay, here, and this area before the circle, the diameter is the largest. Okay, the tip is the smallest number represents to the diameter at the tip in mm. Okay, this is the diameter in mm. Okay, fine. So these are the how it is sterilized. Autoclaving. Okay, all metallic instruments which are not sharp can be sterilized with autoclaving. Okay, fine. Sorry. Yeah, Foley's, it has to be sterilized by, okay, I didn't tell that. It is sterilized by ETO or gamma irradiation. Same. Okay, all plastic tubes, latex tubes, rubber tubes, they are sterilized by ETO, ethylene oxide, or gamma sterile irradiation. Okay, I'll just show you also over here. Okay, so here you can see what is written over here. Ethylene oxide. Okay, sterilized using ethylene oxide. Okay. Okay, in RELS tube it has not been mentioned, but it can also be used sterilized using ethylene oxide or gamma irradiation. Okay. Okay, we'll move on to the next tube. This. Yeah, what is it? Bigger size bougie or dilata? Metallic catheter. Okay, male, female, male. Okay, it's longer, so that is why it is a male metallic catheter. Okay, so it is blunt at the tip. It has got an eye. For this eye has to reach the bladder. Only then it will drain the urinary bladder. There is an outlet over here, and there is a ring like structures which is attached to it. So this is for fixing it. This type of metallic the catheters are usually for intermittent catheterization. Okay, when plastics PVC was not used, these were commonly used for intermittent catheterization. And if you want to make it retaining, we have to suture this to the thigh of the patient with the help of this rings. Okay, with the help of this rings you can just suture it to the thigh of the patient. Some used to suture it with the prepuce also, but that will be painful, so we suture it with the thigh of the patient. Okay, to make it retaining. If you want to keep it for so long time, then this can be used. Okay, that is the only use, and it is sterilized by autoclaving. Fine. Okay. This one. So there is another female metallic catheter. I think that I have missed it. I didn't bring it. So that is also there. Okay. The length will be shorter, but it will look similar. Okay, except is the length. Okay. So what is this one? So you can see there is a tube inside a tube. So what it is? It's a suction cannula. Okay, the name is pool suction cannula. So advantage of having a tube inside a tube is that the inside inner tube has also got openings and the outer tube has also got openings. Okay, so what will happen is that while suctioning, sometimes some debris they will come and block the openings of this outer tube. So when suction is there present in the inner tube, this will prevent it from complete blockage. You can take out the debris and again you can use it. If otherwise only single tube is there, if it is getting blocked, then you have to remove, dismantle it, take out the blockage which is present inside and again use it. Okay. So that is a problem when a single tube is there. So tube within a tube, this structure helps in preventing frequent blockage of the suction cannula. Okay. It is used for suctioning blood, secretions, pus during from the operative field. Any surgery which you are doing in the deep may require cleaning of those blood and other secretions as well as fluid, so that you can perform the surgery properly, so that your field of vision is clear and you can perform the surgery properly. Okay. So this is used for that reason. Any surgery, any abdominal surgery, it can be used. Okay, but nowadays disposable are available, so which we are using. The sterility of this is an issue because some debris tissues they lodge within this openings, and it becomes difficult to clean it. Okay, So it's not that we just only sterilize, you have to also remove those debris before, which is a part of sterilization. So that part becomes difficult. So nowadays we are using disposable suction cannulas. Fine. Okay. How it is sterilized? Autoclaving. Okay. So it is a pulse suction cannula. It is used for suctioning out or clearing the blood, secretions, fluid, pus from the operative field, thereby making the operative field more clear for surgery. Okay. It is used in any abdominal surgeries. Fine. And is sterilized by autoclaving. Okay. Yeah, this we must have seen in ENT. Yeah. What's the name? Okay, I don't know the name. It's a tongue depressor. Okay. Like in ENT for examining the tongue. Okay, or you can examine the posterior pharyngeal wall to examine the tonsils, tonsillar pillars. By depressing the tongue, this can be used. Okay. So there is a hook-like thing which has to lie like this. Okay, this is just for gripping, and you have to hold it like this. Okay, it is usually held in the left hand. Okay, with the left hand you have to depress the tongue, and with the right hand, if you want, you can use a torch, or with the gloves you can do the examination. Okay, so tongue depression. This is the tongue depression. It has to be, you have to insert and depress the tongue. Okay. Sterilization, autoclaving. Okay. This one, it is a Morris retractor. Okay, if there are only one, that is a Morris retractor, and this is a double-ended or double-sided Morris retractor. Okay, MORRIS, Morris retractor. So what it is used for? Retracting what? Liver, it is not used. Okay, so this hook or projection you are seeing, hook-like thing at the edge. So this is going to injure the liver. Okay, so it is. Why is it for then? Not for urinary bladder. Urinary bladder is also rounded, so it is used to retract the abdominal wall. Okay, so what will happen is your wall is, it will be somewhat like this. Okay, so this one, it will be helpful in retracting. So, and this helps in preventing slipping. If it would have been flat, then this would have slipped. Okay, so there is the advantage of having an angle, right angle, the tip bent at right angle. Okay, on both the sides. Fine. So it is a double-sided or double-ended Morris retractor. It is used for retracting the abdominal wall during any laparotomy surgeries, and it is sterilized by autoclaving. Okay. Yeah. Okay. These are all self-retaining retractors. Okay. This must have seen in ENT. Looks like F. Ferguson. Mouth gag. Okay. You must have seen in ENT, na? It is used over that. We don't use it. It is only used to keep the mouth open while performing any dental surgeries or any ENT surgeries, or for inspection of the oral cavity under anesthesia. Okay. So it is sterilized by autoclaving. Okay. So it has got this handle. Okay. It has got a handle. These are the handles. Okay. So this handle has got grooves in it for better gripping. Okay. And these are the blades, and the tip is flattened. The blades are so distal part is called the blade. Okay. So the blades are bent like a hook, and the tip is flattened. So this is to grip against the tooth. Okay, and when you press it, it will open like this, and this ring is there. This can be slit distally, so that it will keep it in position. Fine. Okay, so it is sterilized by autoclaving. Yeah, this one. This one also must have seen in ENT. Jowls, thyroid, self-retaining thyroid retractor. Okay. So what it is used for? It is used to hold the incised margins of the flaps. Okay. So in while doing a thyroid surgery, they will be giving an incision, incising the platysma, and you will be creating a subplatysmal flap. Okay. So these flaps are held separate from each other with the help of this Jowls self-retaining thyroid retractor. So it has got two clips. You can see over here, one clip here above. This is one more clip. So which can be opened up by this. So what you do is that with one clip you hold one flap, lock it. With other clip you hold this one, it's open, hold another flap and lock it, and then there is a screw mechanism over here. Okay, so when you rotate it, these will separate each other, move away from each other, thereby helping retracting the flaps. So you, while doing thyroid surgery, you need two pairs of this Jowls self-retaining retractor. Okay, two are needed. One angle, so incision will be like this. So one on this side and another on this side. Okay, you need two pairs of this retractor while performing thyroidectomy. It is also sterilized by autoclaving. This also you must have seen in ENT. Okay, Mollison self-retaining mastoid retractor. Okay, so this is slightly separate from other instruments. It has got rings. Okay, where I'm inserting my thumb and the ring finger. These are the rings. Okay, there is one lock mechanism over here that is called the lock or the ratchet. Okay, so this is the shaft, this is the shank, this is the joint. Okay, the joint is this one. Okay, this is the joint, this is the shaft, this is the lock or the ratchet, these are the blades. Okay, and here at the tip you can see there are a number of hooks are there, 4 on each blade. Okay, and these hooks are curved. Can you appreciate it? Like this. Okay, the hooks are curved. So this helps in a better gripping of the tissues while retracting. And these are used to grip the skin, muscle or fascia of the scalp. Suppose you're doing any craniotomy or you're doing any mastoid surgery, before you incise over the bone, to keep the skin, muscles and the fascia along with the subcutaneous tissue retracted, you can use this self-retaining retractor. Okay, so it is sterilized by autoclaving. Okay, last one. This is also a mouth gag. Okay, that was Ferguson's mouth gag. This is Doyen's mouth gag. Okay, Doyen. Okay. Same thing, purpose. It is used to keep the mouth open while performing ENT, dental or any oral surgeries. Okay, it has also got 2 rings, one for the thumb and one for the ring finger. It has got a ratchet or the lock mechanism. Okay, this is the joint, and the blades are curved and bent at the tip. You can see it is bent at the tip. So like it goes inside like this, and after inserting, then if you open it, it will keep the mouth open. Okay, So these will rest over the tooth, and your mouth will be the mouth of the patient will be kept open, and you can perform the surgeries whatever you want easily. Okay. So this is Doyens. Okay. Okay. So I'll again one more time show you all those instruments. You have to tell the names. Okay. What is this? Doyens mouth gag. Joel's self-retaining thyroid retractor. Ferguson's mouth gag. Very good. This one, tongue depression. Okay. Okay. Suction cannula. Okay. What suction cannula? Name is Pools. Urethral dilator or bougie. Okay. Lister's urethral dilator or metallic bougie. Metallic male catheter. Two-sided or double-sided Morris retractor. This is the Police. Okay. Ralph's tube. Let's see. Yeah, I think it's in my bag. That female. Yeah, it is that. You can see the difference in the length. Okay. So there was only a single eye, but here there are multiple openings are there. Okay, the function is the same only. But some debris, if it is there, if it is not coming out through this openings, so it will get blocked. So they have placed multiple small openings. Okay, function is the same, intermittent catheterization. Fine. Okay, here we have a single rib ring. This can also be fixed if you want to make it retaining. Okay, to this end you can connect the bag. Fine. Okay, so all these metallic catheters, the tip should be blunt. See, it is blunt over here. Here also it is blunt. Fine. Okay. Okay, if you want, you can come over here and see this. If in doubts are there, you can ask. Huh?